Hello everyone, we are back again on the inner surface of the mandible, and you have seen the mylohyoid line, mylohyoid groove, superior genial tubercles, inferior genial tubercles, genioglossus, geniohyoid, digastric fossa, posterior belly of digastric, mylohyoid vessels and nerve in the groove, sublingual fossa, submandibular fossa, alveolar process with the teeth. Behind the third molar, the attachment of the end of the attachment of the buccinator, pterygomandibular raphe, and superior constrictor. So the pterygomandibular raphe gives attachment to the buccinator on this side and the superior constrictor on this side, and over here you have the relation with the lingual nerve. Now we had said that on this medial surface you have this large mandibular foramen, and you can see that this mandibular foramen is guarded by this tongue-shaped spicule of bone, which is called the lingula. And through this mandibular foramen you have the passage of the inferior alveolar vessels and nerves. So this inferior alveolar nerve and the lingual nerve, they are both branches of the mandibular nerve. So this mandibular nerve gives inferior alveolar nerve going deep inside. It gives the lingual nerve almost touching the third molar, and it gives the auriculotemporal nerve going backward and curling around the neck of the mandible over here. This is the head of the mandible and this is the neck of the mandible on the condylar process, and just anterior to the neck you can see the pterygoid fovea or pterygoid fossa, the depression for the attachment of the lateral pterygoid muscle. So lingual nerve, inferior alveolar nerve, auriculotemporal nerve, and through this mandibular notch you have the masseteric nerve. And this inferior alveolar nerve, when it enters the mandibular foramen, it passes through a mandibular canal within the substance of the body of the mandible, and before entering it gives the mylohyoid vessels and nerves, which is coming down through the mylohyoid groove below the mylohyoid line. And this lingula, which guards the mandibular foramen, gives attachment to the sphenomandibular ligament extending from the spine of the sphenoid. Now when this sphenomandibular ligament is extensive, this nerve to mylohyoid, the mylohyoid vessels and nerves have to pierce the sphenomandibular ligament. They may not. And anyway, the mylohyoid vessels and nerves are coming down through the mylohyoid groove over here. And to the rest of the inner surface of the ramus of the mandible, you can see the attachment of the medial pterygoid muscle, quite a robust attachment with grooves formed by the fibrous septa within the muscles. And here is the angle of the mandible between the lower border and the posterior border of the ramus, and to this angle of the mandible is attached the stylomandibular ligament, which is again a thickening of the deep cervical fossa, the investing layer of the deep cervical fossa. And again, if you look at the coronoid process on the inner surface, again you can see the attachment of the temporalis muscle. So now you can see that all the four muscles of mastication are attached to the mandible. You have the masseter on the outer surface, you have the temporalis to the coronoid process, you have the lateral pterygoid to the pterygoid fovea and the anterior surface of the neck of the mandible, and you have the medial pterygoid on the inner aspect of the ramus of the mandible and going on up to the angle of the mandible. And again along the posterior border of the ramus of the mandible you have the parotid gland. Now medial to the neck of the mandible over here you have the maxillary artery. Why? Because we have already said that the external carotid artery enters through the parotid gland and it splits within the parotid gland into a superficial temporal artery and a maxillary artery. So the maxillary artery from the external carotid will be traveling in this direction. So over here you have the relation of the maxillary artery, and from the mandibular nerve you have the auriculotemporal nerve coming in this direction. So auriculotemporal nerve, maxillary artery, inferior alveolar nerve, lingual nerve. So these are the structures that you have to know along with a study of the mandible. Let us see what else is there to see. Again, in this diagram you can see the mandible and you can see the cutout portion of the masseter, the temporalis. You can see here the lateral pterygoid muscle, and you can make out from the inner surface of the mandible the medial pterygoid. So masseter, temporalis, lateral pterygoid, medial pterygoid, all attached to the mandible. Again, here in this diagram of the mandible you can see the temporomandibular joint capsule, and you can see the lateral ligament of the temporomandibular joint, how it is attached to the side and posterior surface of the neck of the mandible. If you look at this diagram, you can see that the mandible, the ramus has been slightly cut off, and behind the mandible here we were saying is the auriculotemporal nerve. So you can see the auriculotemporal nerve curling behind the neck of the mandible, and you can see the external carotid artery going and dividing behind the neck of the mandible into superficial temporal and maxillary arteries, and between the mandible and the styloid process you can see the gap for the lodgement of the parotid gland, from where it will spill over into the adjacent structures. In this diagram you can see that the inferior alveolar nerve, it enters the body of the mandible into the mandibular canal. It gives the branches to the teeth of the lower jaw, and then it emerges as the mental nerve on the outer surface of the body, and it becomes cutaneous over the face. That means even beyond the emergence of the mental nerve, the inferior alveolar nerve has additional branches going right up to the incisor teeth. So this thing you have to keep in mind, that even beyond the mental nerve there are branches of the inferior alveolar nerve. If you look at this diagram of the inside of the mandible, you can see the line of attachment of the mylohyoid muscle along the mylohyoid line, and you can see above the mylohyoid line the sublingual fossa with the sublingual salivary glands, and below the mylohyoid you have the submandibular fossa with the submandibular salivary gland. Of course, what you can see is that a portion of the submandibular gland is still above the mylohyoid. So the mylohyoid actually wedges itself into the substance of the submandibular gland, such that you have a part superficial to the mylohyoid, you also have a part deep to the mylohyoid. In this diagram you can make out again the masseter and temporalis and the lateral pterygoid muscle attached to the mandible, and the capsule of the temporomandibular joint and lateral ligament of the temporomandibular joint. In this diagram you can see the maxillary artery medial to the neck of the mandible and the auriculotemporal nerve passing out behind the neck of the mandible. So auriculotemporal nerve, again you can see the inferior alveolar nerve from the mandibular nerve going into the mandibular canal, and you can see the lingual nerve going almost to touch the inside of the third molar tooth. Now these are the 8 changes of the mandible, which along with the ossification we will discuss in a subsequent video.